morning, respectful students. Let me introduce for your lecture. Theme of lecture is Physiology of Pregnancy and Antenatal Care. Pregnancy and labor as a natural physiological condition in the woman's life or reproductive period. Beginning and duration of pregnancy are determined by the functions of reproductive system. The result of pregnancy and labor for mother and child depending upon the organization of obstetrical services before and ambulatory polyclinic link of the level of primary medical center points. Using in our time practice of natal care in Republic of Kazakhstan is based on the model performing in Europe. It is performed in the conception of the safe motherhood. It is complex of social, economic, legal and medical measurement with direction on delivery of alive children and protection of their life. Exciting practice of antenatal care in the Republic of Kazakhstan was introduced in practice according to the law and order of the Ministry of Health from the 2010 and are making perfected according to the modern clinical protocols. Physiology of pregnancy. The conception, rearing of pregnancy and labor are the elements of reproductive function of female organism. Reproductive function is performed due to ovarian function firstly and uterus. In ovaries there is a maturation of ovum, and in uterus there are changes due to influence of hormones for preparing of uterus to take or fertilize ovum. Ability of female organism to perform these changes are the period of life that has a name, reproductive or fertile period of life. This period has continuation from 15 years from appearance of the first menstruation and has continuation till 49 years. According to World Public Health Organization conception, it is a period from 17-18 years till 49-50 years. This is such clinical characteristic of novelty menstrual cycle, this period. The first day of menstruation has name of the first day of menstrual cycle. There are such changes in ovaries during menstrual cycle. Growing and formation of dominant follicle, ovulation and going away of the mature ovum, formation of corpus luteum. Production of the sexual hormones are performed at the same time, estrogens and progesterone, performing the changes in the uterine mucus for the collection of the fertilized egg. For the beginning of pregnancy, it is necessary to have in the same time the day of ovulation and presence of spermatozoons at the sexual day of woman. It is performing on 16th day of menstrual cycle if the cycle is 28 days. As the ample part of the uterine tube, the fertilization is performing, going together ovum and spermatozoons. In first days, plastamera reaches an uterine cavity, performing implantation in the metrium that has a condition of before implantation preparing. The implantation is performing during the second 2 days from the beginning, and the pregnancy is started with continuation during the 40 weeks, or it calls 10 obstetrical months. There are changes in the female organism during the pregnancy, such as the synthesis of chorionic gonadotropin is started. This hormone is produced only during the pregnancy. The changes are performing in all organs and systems. These changes are performing due to hormonal changes due to pregnancy. Chorionic gonadotropin is growing fast. It is the basis for the determination of pregnancy by test. Due to started pregnancy, there is increasing of body mass. There is increasing of volume circulated blood on 30–50% due to formation of uterine and placental blood flow and more intensive metabolic processes. During a pregnancy, the normal index of blood pressure may be 140 or 90 mm of equilibrium. There are changes in the respiratory system. The necessity in quantity of the oxygen is increasing on 15–20% during the pregnancy. Gastrointestinal tract is relaxed under the progesterone action. Due to relaxation of urethra, the infection of urinary tract is developed. At the bones articulation system, there is a softness of ligaments, particularly in the pelvic ring, that makes better the condition of the fetus going in labor. The pregnancy without complications and coordinated with the term of pregnancy and has at end the delivery of the live full-term newborn has name of physiological pregnancy. Full-term baby is a baby who was delivered at the time of pregnancy from 37 till 42 weeks. Determination of the term of pregnancy is performed by the few methods. Determination of the pregnancy term. Firstly, I tried to find the term of pregnancy according to the ultrasound examination dates in cases if ultrasound examination was done till the 14 weeks of pregnancy. Secondly, on the date of the last normal menstruation. The first day of the last menstruation is known the 0 day. Day from 0 to 6 it is whole 0 week. And after that, from 6 to 13 days, it will be the first pregnant week. On the date of uterus size, it is possible to find the time of pregnancy after the first visit to female consultation, if the first visit was done early till the 12 weeks of pregnancy. The hygiene of pregnant woman. The clean condition of woman's skin during the pregnancy are for the supporting of its protection function. During the pregnancy, the warm or contrasting shower at useful temperature of water, 37 degrees, should be the better than another procedures. The baths from the sun at the warm, a good ventilated room with the continuation till 10 minutes may be used. Hyperthermia, a severe hypothermia, is contraindicated for the pregnant woman, but why it is not advised to go for the hot bath or sauna. The high temperature is the reason of gingivitis or stomatitis development. Clothes of women should be wide, don't press the chest and abdomen, particularly during the second half of pregnancy. From the first month of pregnancy, it is necessary to wear a bandage for protection of abdominal muscles from distension. Pregnant woman is recommended to wear the free shoes on the lower heels. The high heels makes the tenderness in the legs. The food of pregnant woman. The main particularity of pregnant woman feeding is the natural character of it, different without minimum content of substitute ingredients and the light metabolic substances. The structure of feeding should be looked like a pyramid. It is necessary to know a term of pregnancy. As the first half of pregnancy, to feed is usually at 4 times per day. As the second half of pregnancy, it must be 5-6 times per day, a small portion for prevention of the bad sensation, such as gases inside of abdomen. Now I will tell you before labor care according to World Public Health Organization conception. Pregnancy is one of physiological conditions of female organism, but why it should be counted as a normal. It is possible to have a different presence of some complications in the stages of the pregnancy duration. Due to that, a medical staff, a doctor or midwife should be very attentive for the finding of the symptoms in time. The main principles of the before labor care are attentive relationship to the all pregnant woman, using of the individual protocol of care, plan of management, changes of assessment of mother and fetus condition after every visit at the antenatal clinic. It is necessary for every woman to come in primary medical center puncture till the 12 weeks of pregnancy in the Republic of Kazakhstan. The quantity of visit is only 7. There are special measures for every visit of pregnant woman in the range of the before doctor care. The contents of every visit. First of all, it will be consultation. Secondary, investigation. Thirdly, it will be laboratory and instrumental examination. Fourth, consultation of specialists. And fifth, it is a medical prophylaxis measures, according to indications. Consultations. Recommendation about the lessons visit about preparing to labor, giving the oral form about problems with possibility to ask of questions, discussion, writing of all the result in the test, findings of the factors risk of preeclampsia among the pregnant women. During the second visit, to give information about the alarming symptoms, to choose the alarming symptoms. During the fourth visit, to give information about a plan of labor, to give information about breastfeeding, postpartum contraception with possible discussion. Discussion of questions about methods of delivery during the 7th visit. Alarming symptoms. Bloody discharge from sexual way. It is alarming symptom, more serious. Fluid discharge from the vagina, constant headache, disturbances of visual, a fast or face edema, increasing of temperature till 38 and more, severe itching, burning and pains in cases of urination, severe pains in abdomen, more than 4-5 labor pains during 1 hour. If you make of abdominal trauma, if a fetus makes less than 6 movements during 2 hours or 10 movements during 12 hours. Examination. The height and mass of woman should be taken during the first visit. Examination during all visits should includes checking of blood pressure, examination of legs for the finding of various veins. From the 20 weeks of pregnancy, measurement of the height of fundus, engraviogram performing, auscultation of fetuses performing after 24 weeks of pregnancy. Before postpartum holiday are given from 30 weeks of pregnancy. Laboratory examination. They obligate, and according to indications in examination, obligate investigation of urine for protein contents every visit to a doctor, back investigation of urine till the 16 weeks of pregnancy, at 10-14 weeks, ultrasound examination for detection of congenital defect of fetus. Consultation of specialist. For everybody, consultation of a doctor, physician or family doctor. Consultation of genetic on indications. The indications are in the age of woman more than 35 years, congenital defect of fetus in anamnesis, 2 or more abortion in anamnesis, in cases of the relative connection in a marriage. Medical prophylactic measures. Using of acidic folates for everybody for prophylaxis of central nervous system congenital defect. Every day woman should use 0.5 milligram every day during the first trimester. In the cases of risk factor of preeclampsia, if I found the risk factor, I should give for woman the calcium in the dose 1 gram till 40 weeks. Aspirin 75 and 25 milligram a day till 36 weeks of pregnancy. Introduction of the anti-D immunoglobulin at the 28 weeks of pregnancy in cases Rh negative blood without titer of the antibodies. Postpartum patronage. The first patronage should be done by the midwife during the first 3 days after labor. The examination of puerpera should be done after 4 weeks. According to the regionalization rules of prenatal health in Republic of Kazakhstan, hospitalization of the pregnant woman is performing in coordination of the levels of prenatal health level. Planning hospitalization is performing according to direction of the primary medical center puncture, urged by the emergency car. In cases of the extragenital pathology at the time of pregnancy, before 30 weeks, according to indication, without obstetrical complications, hospitalization should be done according to profile of disease. For example, in the urological department, maybe physician department, therapeutic department, according to the quantity of the diseases. Regionalization of the medical help is performing according to the 3 levels of regionalization. The organization of the first level of the woman without any complications of pregnancy and labor, physiological pregnancy in a term. So this maternity home of the first level are maybe a little, not completely filled, because in our country there are small quantity of women without any complications. Organization of the second level is for women with not complicated duration of pregnancy and labor, preterm labor in term of pregnancy from 34 weeks and more, and for pregnant women with not heavy obstetrical pathology. Organization of the third level. There are prenatal center, district hospital, etc. There are for the hospitalization of pregnant women with a risk of prenatal pathology, realization and preterm labor at the time of pregnancy, 22-33 weeks plus 7 days. It is possible to hospitalize the woman with non-complicated duration of pregnancy according to their wish. Thank you for attention.